Hello, welcome to Female Nature. I am your host, Victoria Chinenye Okoli. Thank you for subscribing to our channel and thank you for joining us today. So, on this episode, we'll be looking at medical options for the treatment of fibroids. Last week, at the last episode, we looked at options, the natural options for shrinking and treating fibroids. So today, we'll be considering some medical intervention options for the treatment and management of fibroids. Firstly, let's look at option one, tranexamic acid. Tranexamic acid is not really for the treatment or total treatment or eradication of fibroid. What it is a medication that helps to ebb the flow of blood. It helps to reduce bleeding. So if a woman is having problem with too much bleeding associated with fibroids, their doctor or the hospital that they attend may prescribe tranexamic acid for them to help reduce the bleeding. So it doesn't really eradicate fibroid, but it reduces blood flow. The second option is gonadotropin releasing hormone, or GnRH for short. This medication, it can be in the form of injection or tablet. It is mainly for a quick shrinking of the fibroid. It helps to shrink the fibroid, and the medication is not to be used for a long period. So it helps to shrink the fibroid for people who are planning to have surgery anyway. If the fibroids are too big, and in order to make them a bit, to shrink a bit and be a bit smaller, and for ease of surgery, their gynecologist or their medical practitioner might prescribe GnRH for them to use for a short course, maybe for a few weeks or so, or a few days, or maybe up to 3 months, to help shrink the fibroid so that surgery will be easier. So for option two, it is better for people who are planning to have surgery to remove the fibroids, or to have surgery as the management option. It will shrink the fibroid a bit in size and make the surgery a bit easier. The third option is uterine fibroid ablation. This option uses um, high frequency radio frequency heat, high level of heat, to burn the fibroid inside the womb. I must let you know that it takes a long time for the woman to see any difference, to experience any difference when the fibroids are burned. The idea is the fibroids are burned, and then they start to shrink inside the womb. And over time, maybe a course of 6 months, 12 months, more than a year, however long it will take, the fibroids will shrink, and then the fibroid tissues will be reabsorbed in the body. So the fibroid doesn't come out. So it is treated with high level of heat. That's for that one, and people need to bear in mind that it is not you don't see immediate results. So for people opting for this, they have to give it time. And I must say that it is not really ideal or beneficial for somebody who is trying to have a child to go for this option, because the result can take a long time. And again, the fibroids can grow back. The little cells, the tiny fibroids, which have not been heat treated, can still grow over time, especially if the woman is not close to menopause. that means the level of estrogen is still high and the fibroids will be feeding and thereby grow. And again, the fibroids, if they haven't died off properly for the big ones that have been heat treated, if they haven't died off fully, if they haven't been treated fully, and if they haven't shrunk fully, it is likely that they might start to get nourishment again and recover. So it might be better for people who are nearing menopause. They know that once they do the treatment, menopause will kick in. It won't kick in straight away, but when they get to that stage of um, menopause, that the estrogen level will be quite low and likely they won't suffer the effects of large fibroids anymore. Let's look at option number 4, myomectomy. This is generally the option that is mostly in use, and for this option, the woman is cut open, the fibroids are brought out. So they are not left inside, they are brought out. But there are three methods that can be used for this option, depending on the size or number of the fibroids. If the fibroids are too large, the woman will be cut open. It might be from belly button down to the pelvic region, or it might be what we call bikini line incision, which will be from left to right or from right to left, but just across the pelvic area instead of up to down. So the fibroids will be brought out through that big incision. But if the fibroids are not too big, there might be the use of what we call keyhole surgery. So the woman might have about 4 or 6 holes put on her belly. This way, the fibroids will also be pulled out. So for the keyhole, you have a quicker recovery because it's not full cutting of the stomach area. So recovery is quicker. And again, the third method for this option is the fibroids, depending on their size as well and depending on their number, they might be brought out through the cervix, through the vagina area. So there won't be any keyhole, there won't be any holes put on the belly area, and the woman will not be cut open either vertically or horizontally. So these are the three methods under option 4. And I must say that it is better for women who are still trying to have children. If they haven't completed their family, they are still trying to have children, or they are trying for the first time to conceive and they're suffering with fibroids. Option 4 might be a better option in the sense that if the fibroids are big, the woman will be cut open and the fibroids brought out. The woman will allow herself to heal maybe about 3 months or so before starting to try again to conceive. So this might be a better option for people who are still trying to have children. Or even if they are not trying to have children still, they may still prefer to have all the fibroids come out instead of thinking when will they shrink completely and all that in terms of option 3 above that we discussed. So that's that one for option 4, which is generally what people do in most places. Yeah. So option number 5 is what we call uterine artery embolization or uterine fibroid embolization, UAE or UFE. Both are the same. For this option, which is a bit similar to option 3, but option 3 uses heat to kill the fibroids inside. Option 5 will use tiny particles, and option 5 is normally done in the X-ray department. They will use the surgeon or the person in charge will use tiny particles to block the arteries that supply blood to the fibroids. the woman is not cut open, what happens is there will be a puncture on the femoral artery. The femoral artery is the big artery on every human being that runs from head to toe on the left and on the right side of the body. So the surgeon in charge will puncture a hole on the big artery and pass through them, put some things like some wires, whatever they use, they will gain access to the fibroids from the puncture on the femoral artery. So they will go through there and then use the tiny particles to block all the arteries that supply blood to the fibroids. So over time, the fibroids will start to shrink and flush out of the woman's body. I must say that this option can be painful. In fact, options for shrinking fibroids can give a woman pain, stomach pain, because when the fibroids are dying off, they are struggling to survive. So that struggle is pain on the woman. So for the embolization, it is normally when the procedure is being done, it is recommended, strongly recommended, that for about 4 hours following surgery, while the woman is still in the hospital, just from the theater to the ward, they don't move their leg, that side of the leg that was punctured. They don't move their leg for about 4 hours because any move can affect the shape and the functionality of the femoral artery. So if a woman is opting for this, if this is their choice of intervention, it is good if they have somebody with them in the ward after they once they come back from the theater, so that the person, a family member, a friend, can just hold their leg down or make sure that the leg is straight for about 4 hours. The hospital will advise as well, but it's just for people to know that this is the likely implication of having this method of medical intervention. And again, what I need to let people know is embolization. I don't think it is the right choice for people who have large fibroids. Reason being that if the fibroids have been starved and they are shrinking, over time, the big fibroids or the fibroids generally will start to be flushing out from the woman's birth canal. If the fibroids are too big, they won't be able to come out on their own. So people need to bear this in mind. You need to think about it this way. If a woman is pregnant and they go into labor, the body starts to prepare through contraction to help the baby push out. But in this case, because there's no pregnancy, the body is not preparing for any contraction to naturally help whatever is inside. In this case, in this case now is the fibroid. So the body is not taking any natural intervention to help push out whatever is there. So that means that the woman may go on bleeding. If the fibroids are big, they will still take time to shrink to the size that they can come out through the woman's private area. If not, they will keep shrinking over time, and that means the woman every day she is bleeding, every week she is bleeding because the dead fibroids are just they are dripping because they haven't been able to flush out completely. So it will be drip, 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 blood coming out. So the woman will be like having her period or having blood for a long time. This is not a good option. And people need to bear in mind if there is constant bleeding like that, it might cause issues like sepsis, which can be an emergency situation. So people need to bear in mind that if the fibroids are big, embolization may not be a good option. I suggest that people have a myomectomy, especially if they are still planning to have children. Have myomectomy, recover, and then start trying to conceive again. And for even myomectomy and embolization, the fibroids can still grow back because the womb is there. The fibroids can still grow back because the ovaries are there, still producing estrogen. The fibroids can still grow back. So these options that we've looked at now, like 2, 3, 4, and 5, the fibroids can grow back, and most of the time, about 80% of the time, the fibroids will come back. And even the little cells, the little fibroids that haven't been touched, they haven't received any sort of embolization or any sort of intervention, they will feed and grow unless the woman is near menopause. That's that for option 5. So let's look at options 6 and 7. 6 and 7, they are more or less the same, but the only difference is for 6, which is partial hysterectomy. Most of the time, only the womb is taken out. We know that the fibroid is being housed in the womb, around the womb area. So once the womb is taken out, the likelihood of the woman suffering with fibroids is greatly reduced. But the thing is, the woman will still be having like a cervical smear test. They still have to take care of their reproductive health in terms of the fallopian tubes are there, and the ovaries are there, the cervix is there, as we mentioned. So they still need to take care of their reproductive health. So the womb is out, and likely the fibroid problem will be resolved. But people need to bear in mind that there are other things that they still need to keep an eye about, take care of, and make sure that there are no issues in the future. Like we mentioned, the ovaries and fallopian tube and cervix and all that. So the difference between the partial hysterectomy and the total hysterectomy is that the womb is out. And for partial, other things, maybe the woman may choose, if they have a problem with their fallopian tube, they might decide to take it out. But not everything in that reproductive area comes out. But for option 7, total hysterectomy, this option enables a woman to take the entire reproductive area, entire reproductive system out. The womb, the ovaries, the fallopian tube, the cervix. When a woman chooses to do total hysterectomy, they don't have to worry about doing smear test anymore. What I must emphasize is once the ovaries are out, menopause kicks in. So the woman with, no matter their age, once the ovaries come out, the woman will start having symptoms of menopause, foggy brain, dryness, different things. We'll talk about menopause in future episodes. So these are the main, for 6 and 7, these are the main differences. For 6, the womb is out. Maybe one or two other things might come out, but generally people leave everything else apart from the womb that comes out. But for total hysterectomy, it's complete hysterectomy. Everything comes out, and this triggers menopausal symptoms for the woman. It is good for people to know that the options that we've looked at up from 2 to 5, 1, we know that it's not really for treatment or shrinking of fibroids, it's just to reduce the blood flow. But 2 to 5, As long as the womb is there is a very high chance of fibroids growing back. So it's for people to choose carefully and to discuss with their medical practitioner what suits their individual need. But it is good for people to know the options and to prepare so that they will make the best choice that suits them. That's all we have time for this week. Thank you so much for joining us. Thank you for subscribing. Please share this video with all the people around you. If you are a man, please share with all the women in your circle. And my fellow women, please share it with other women around you. Even for young women, it is better for them to know, it is better for them to be aware of everything that is relating to female reproductive system. So hopefully at the next episode, we will look at um, options in relation to what we have, not really options, but what happens if fibroids are not taken care of. What will be the effects really, not options. So we'll look at what are the effects of fibroids if left untreated. Until then, look after yourselves and God bless you.